October 28, 2024. For AM. Version 18. Title: Unlocking the Mystery of Delayed Phase Sleep Syndrome, DPSD Understanding, Managing, and Thriving with a Rare Sleep Disorder.
Disclaimer. The information provided in Unlocking the Mystery of Delayed Phase Sleep Syndrome, DPSD Understanding, Managing, and Thriving with a Rare Sleep Disorder is for general informational and educational purposes only. This book does not provide medical advice and is not a substitute for professional medical consultation, diagnosis, or treatment. Readers should consult a qualified healthcare provider for advice and services tailored to their specific medical conditions or symptoms, including DPSD or other sleep disorders. Any reliance on the information provided in this book is solely at the reader's discretion and risk. The author and publisher are not responsible for any adverse effects, misunderstandings, or outcomes resulting from the use of the information contained herein. Every effort has been made to ensure that the information in this book is accurate and up-to-date. However, medical knowledge is continuously evolving, and new insights may supersede or refine the information presented. Readers are encouraged to seek professional advice and consult current research findings to verify information and pursue effective solutions for their health concerns.
October 28, 2024. Version 18. Title: Unlocking the Mystery of Delayed Phase Sleep Syndrome, DPSD Understanding, Managing, and Thriving with a Rare Sleep Disorder. Table of Contents. Introduction to DPSD. What is Delayed Phase Sleep Syndrome? Understanding the basics of sleep. Defining DPSD, causes, symptoms, and diagnosis. The impact of DPSD on daily life. The science of DPSD, unraveling the sleep-wake cycle. Understanding the circadian rhythm. The role of melatonin in sleep regulation. The neurobiology of DPSD, what happens in the brain. DPSD in context, types, triggers, and risk factors. Differentiating DPSD from other sleep disorders. Triggers of DPSD, genetic, environmental, and lifestyle factors. Risk factors for DPSD, who is at higher risk. Diagnosis and assessment of DPSD. Clinical evaluation and diagnosis of DPSD. Sleep studies and monitoring techniques. Psychological assessment and coexisting conditions. Living with DPSD, challenges and coping strategies. The impact of DPSD on daily routine and functioning. Managing sleep disturbances, sleep hygiene, and lifestyle changes. Coping strategies for DPSD, dealing with sleep-related stress and anxiety. Treatment approaches for DPSD. Current treatment options, medications, light therapy, and chronotherapy. Cognitive behavioral therapy for insomnia, CBTI, for DPSD. Emerging treatment modalities, advances in sleep medicine. Lifestyle adjustments and sleep hacks for DPSD. Optimizing sleep environment, tips for bedroom setup. Managing light exposure, strategies for regulating circadian rhythm. Sleep-enhancing strategies, nutrition, exercise, and relaxation techniques. Thriving with DPSD, achieving quality of life. Strategies for maintaining mental and emotional well-being. Nurturing relationships, communicating with family, friends, and employers. Achieving work-life balance, career strategies, and time management. Support systems and resources for DPSD. Connecting with support groups and communities. Seeking professional help, sleep specialists and therapists. Navigating medical and legal issues, rights and advocacy for DPSD patients. The future of DPSD, research, innovations, and hope. Current advances in DPSD research. Promising treatment options on the horizon. Empowering the DPSD community, raising awareness and advocacy efforts. Appendices. Glossary of terms related to DPSD. Frequently asked questions, FAQs, about DPSD. Resources for further reading and information. Index. Please note that this book is intended to provide general information about DPSD and is not a replacement for professional medical advice. Always consult with a qualified healthcare provider for diagnosis, treatment, and management of DPSD or any other medical condition. Chapter 1. Introduction to DPSD. Definition and overview of delayed phase sleep syndrome. History and background of DPSD. Common symptoms and impact on daily life. Challenges and misconceptions related to DPSD. Chapter 1. Introduction to DPSD. As the sun dipped below the horizon and darkness enveloped the world, most people would find themselves getting ready for bed, preparing to snuggle under the covers and drift off into a peaceful slumber. However, for those with delayed phase sleep disorder, DPSD, the night was just beginning and sleep would remain elusive for hours to come. DPSD, also known as delayed sleep phase syndrome or delayed sleep-wake phase disorder, is a circadian rhythm sleep disorder that affects the timing of sleep. The circadian rhythm is the internal clock that regulates the body's sleep-wake cycle, and for those with DPSD, this internal clock is out of sync with the typical sleep-wake schedule of society. In this chapter, we will delve into the world of DPSD, providing a comprehensive overview of this condition that disrupts the sleep patterns of those who live with it. We will explore the history and background of DPSD, shed light on its common symptoms and the impact it has on daily life, and address the challenges and misconceptions that often accompany this misunderstood condition. To truly understand DPSD, it's essential to know its roots. The history of DPSD dates back several decades, with the first documented cases appearing in the 1980s. Initially, DPSD was often overlooked or misdiagnosed, as the medical community lacked awareness and understanding of this relatively rare sleep disorder. However, with advancements in sleep research and increased awareness in recent years, DPSD has gained recognition as a legitimate sleep disorder that affects a significant number of individuals. DPSD is characterized by a persistent delay in the timing of sleep compared to the desired or socially acceptable sleep schedule. People with DPSD often find it challenging to fall asleep at a conventional bedtime, such as 10 p.m. or 11 p.m., and instead, their natural sleep-wake cycle is shifted to much later hours, often in the early morning hours or even beyond dawn. As a result, they may have difficulty waking up in the morning and may feel groggy and fatigued during the day, leading to difficulties in their daily functioning. The symptoms of DPSD can vary from person to person, but common ones include difficulty falling asleep at the desired bedtime, trouble waking up in the morning, daytime sleepiness, and difficulties with concentration and performance during the day. The impact of DPSD on daily life can be significant, as it can affect one's ability to maintain regular work or school schedules, participate in social activities, and even have a negative impact on mental health and overall well-being. Living with DPSD can be challenging, and individuals with this condition often face misconceptions and misunderstandings from others. Some people may assume that those with DPSD are simply night owls who choose to stay up late and sleep in, rather than recognizing it as a legitimate sleep disorder. Others may view DPSD as a lifestyle choice rather than a medical condition, leading to misconceptions about laziness or lack of motivation. However, it's crucial to understand that DPSD is a real and debilitating sleep disorder that is beyond the control of those who experience it. In conclusion, this chapter serves as an introduction to DPSD, providing an overview of the definition, history, and background of this sleep disorder. We have explored the common symptoms of DPSD, its impact on daily life, and the challenges and misconceptions that individuals with DPSD may face. As we delve deeper into the intricacies of DPSD in the upcoming chapters, we will gain a deeper understanding of this condition and explore strategies for managing it effectively. Chapter 2. The Science of DPSD. Delayed Phase Sleep Syndrome. Understanding the basics of sleep and the circadian rhythm. Neurobiology of DPSD. How circadian misalignment affects sleep-wake cycle. Role of melatonin and other hormones in sleep regulation. Latest research and scientific advancements in DPSD. Chapter 2. The Science of DPSD. Delayed Phase Sleep Syndrome. As Sarah sat in her dimly lit bedroom, staring at the clock that read 2 a.m., She couldn't help but wonder why she always struggled with sleep. She had tried everything from establishing a bedtime routine to taking sleeping pills, but nothing seemed to work. Little did Sarah know that she might be suffering from a condition called Delayed Phase Sleep Syndrome, DPSD. Intrigued, she decided to delve deeper into the science of DPSD to understand why her sleep patterns seemed so out of sync. Understanding the basics of sleep and the circadian rhythm. Sleep is a fundamental physiological process that is vital for our physical and mental well-being. The circadian rhythm, also known as the internal clock, is a 24-hour biological cycle that regulates the timing of various physiological and behavioral processes, including sleep and wakefulness. The circadian rhythm is influenced by external cues, such as light exposure, and is regulated by a complex interplay of genes, proteins, and hormones in the brain. Neurobiology of DPSD, how circadian misalignment affects sleep-wake cycle. DPSD is a type of circadian rhythm sleep-wake disorder that occurs when an individual's circadian rhythm is misaligned with their desired sleep schedule. In other words, people with DPSD experience a delay in their circadian rhythm, causing them to have difficulty falling asleep and waking up at the desired times. This misalignment can disrupt their daily routine and impact their overall quality of life. Recent research has shed light on the neurobiology of DPSD. It has been found that a region in the brain called the suprachiasmatic nucleus, SCN, which serves as the master clock for the circadian rhythm, plays a crucial role in DPSD. Individuals with DPSD may have a genetic predisposition that causes their SCN to be out of sync with the typical 24-hour cycle, resulting in a delay in their sleep-wake schedule. Role of melatonin and other hormones in sleep regulation. Melatonin, often referred to as the sleep hormone, is a key player in regulating the circadian rhythm and sleep-wake cycle. It is produced by the pineal gland in the brain in response to darkness and helps to promote sleep. In individuals with DPSD, the timing of melatonin release may be delayed, contributing to their difficulty in falling asleep at the desired bedtime. In addition to melatonin, other hormones such as cortisol and serotonin also play a role in sleep regulation. Cortisol, often referred to as the stress hormone, follows a diurnal pattern, with higher levels in the morning and lower levels at night. In individuals with DPSD, the timing of cortisol release may be altered, contributing to their sleep-wake misalignment. Serotonin, a neurotransmitter that regulates mood, appetite, and sleep, is also involved in the regulation of the circadian rhythm. Latest research and scientific advancements in DPSD. The field of sleep medicine is constantly evolving, and researchers are continuously uncovering new insights into DPSD. Recent studies have focused on identifying the genetic basis of DPSD, as well as investigating the role of environmental factors such as light exposure and lifestyle choices in its development. Advanced techniques such as genetic testing, brain imaging, and circadian rhythm monitoring have provided valuable tools for diagnosing and studying DPSD. Treatment options for DPSD include light therapy, which involves exposure to bright light in the morning to help reset the circadian rhythm, and chronotherapy, which gradually shifts the bedtime and wake time to align with the desired sleep-wake schedule. Medications such as melatonin supplements and sleep aids may also be prescribed in certain cases. However, more research is needed too. DPSD. Types, triggers, risks. And we will title this chapter Types of Triggers and Risk Factors of DPSD. Chapter 3. Types, Triggers, and Risk Factors of Delayed Phase Sleep Disorder, DPSD. As the sun set behind the horizon, casting a warm golden glow over the landscape, Sarah's mind raced with anxiety. She knew that as the day turned into night, her struggles with sleep would begin again. For years, Sarah had been grappling with the mysterious sleep disorder that had disrupted her life and left her feeling exhausted and overwhelmed. Little did she know that she was suffering from a condition known as Delayed Phase Sleep Disorder, DPSD, a disorder characterized by a misalignment between an individual's internal biological clock and the external clock dictated by society. In this chapter, we will explore the different types of DPSD, its triggers, and risk factors. Types of DPSD. DPSD can manifest in different ways, with variations in its presentation. The two main types of DPSD are delayed sleep phase disorder, DSPD. This type of DPSD is characterized by a delay in the timing of an individual's sleep-wake cycle. People with DSPD often find it extremely difficult to fall asleep at the conventional bedtime hour and struggle to wake up early in the morning. They tend to have a preference for staying awake late at night and sleeping in during the mornings, resulting in a misalignment with their societal obligations and commitments. Non-24-hour sleep-wake disorder, N24SWD. In this type of DPSD, the sleep-wake cycle of an individual is longer than the standard 24-hour cycle, resulting in a gradual drift of sleep-wake times over time. This means that individuals with N24SWD may have a different bedtime and wake time each day, leading to significant disruptions in their daily routines. Triggers of DPSD. Several triggers can contribute to the development or exacerbation of DPSD, including genetics. Research suggests that there may be a genetic component to DPSD, with a family history of sleep disorders being a potential risk factor. Environmental factors. Exposure to bright light, especially in the evening, can disrupt the natural sleep-wake cycle and trigger DPSD. Additionally, irregular or inconsistent sleep schedules, such as shift work or jet lag, can also contribute to the development of DPSD. Lifestyle factors. Certain lifestyle choices, such as excessive use of electronic devices before bedtime, consuming caffeine or alcohol close to bedtime, and engaging in stimulating activities close to bedtime, can disrupt the sleep-wake cycle and trigger DPSD. Risk factors for DPSD. Apart from triggers, several risk factors may increase an individual's susceptibility to DPSD, including adolescence. DPSD often emerges during adolescence, as there are natural changes in the circadian rhythm during this developmental stage. Hormonal fluctuations and changes in lifestyle, such as increased academic demands and social activities, can also contribute to the development of DPSD in teenagers. Family history. Having a family history of DPSD or other sleep disorders can increase an individual's risk of developing DPSD. Neurological and psychiatric conditions. Certain neurological and psychiatric conditions, such as attention deficit hyperactivity disorder, ADHD, autism spectrum disorder, ASD, and mood disorders, have been associated with an increased risk of DPSD. Personality traits. Certain personality traits, such as being a night owl or having a preference for staying awake late at night, may increase the risk of DPSD. As Sarah lay in bed, tossing and turning, she realized that several triggers and risk factors were at play in her struggle with DPSD. She made a mental note to explore these factors further and seek professional help to manage her condition. In conclusion, understanding the types, triggers, and risk factors of DPSD. Chapter 3. Types, Triggers, and Risk Factors of DPSD. Differentiating DPSD from other sleep disorders. Genetic, environmental, and lifestyle triggers of DPSD. Risk factors that increase the likelihood of developing DPSD. Identifying potential comorbidities and associated conditions. As Sarah sat in the doctor's office, she anxiously awaited the results of her sleep study. She had been struggling with sleep issues for years, and it was affecting her daily life. The doctor walked in with a compassionate smile and began to explain the various types, triggers, and risk factors of delayed phase sleep disorder, DPSD, shedding light on Sarah's condition. Differentiating DPSD from other sleep disorders. The doctor began by explaining that DPSD is a distinct sleep disorder that is often misdiagnosed or confused with other sleep disorders. While DPSD shares similarities with other sleep disorders, it has specific characteristics that set it apart. For instance, DPSD is characterized by a persistent delay in the timing of an individual's sleep-wake cycle, leading to difficulty falling asleep at conventional bedtime hours and waking up early in the morning. This sets it apart from other disorders like insomnia, sleep apnea, or restless leg syndrome, which may have different symptoms and underlying causes. Genetic, environmental, and lifestyle triggers of DPSD. The doctor went on to explain that DPSD can be triggered by a combination of genetic, environmental, and lifestyle factors. Genetic factors play a role in DPSD, as research suggests that there may be a genetic component to the disorder. Individuals with a family history of sleep disorders may be at an increased risk of developing DPSD. Environmental factors can also trigger DPSD. Exposure to bright light, especially in the evening, can disrupt the natural sleep-wake cycle and delay the timing of sleep. Irregular sleep schedules, such as shift work or frequent travel across time zones, can also contribute to the development of DPSD. Lifestyle choices can also be triggers for DPSD. For example, engaging in stimulating activities close to bedtime, excessive use of electronic devices before sleep, and consuming caffeine or alcohol near bedtime can disrupt the sleep-wake cycle and contribute to DPSD. Risk factors that increase the likelihood of developing DPSD. The doctor explained that certain risk factors may increase an individual's susceptibility to DPSD. These include adolescence. DPSD often emerges during adolescence, as there are natural changes in the circadian rhythm during this developmental stage. Hormonal fluctuations, changes in lifestyle, such as increased academic demands and social activities, can also contribute to the development of DPSD in teenagers. Family history. Having a family history of DPSD or other sleep disorders can increase an individual's risk of developing DPSD. Neurological and psychiatric conditions. Certain neurological and psychiatric conditions, such as attention deficit hyperactivity disorder, ADHD, autism spectrum disorder, ASD, and mood disorders, have been associated with an increased risk of DPSD. Identifying potential comorbidities and associated conditions. The doctor also explained that DPSD may be associated with other comorbidities or related conditions. For example, individuals with DPSD may also experience mood disorders, such as depression or anxiety, due to the impact of disrupted sleep on their mental health. It is important to identify and address these associated conditions as part of a comprehensive treatment plan for DPSD. Sarah listened attentively as the doctor explained the various types, triggers, and risk factors of DPSD. It was enlightening to understand that her sleep issues were not just isolated problems, but rather a complex interplay of factors. She realized that a multifaceted approach, addressing both the triggers and potential comorbidities, would be necessary to manage her DPSD effectively. In conclusion, understanding the types, triggers, and risk factors of DPSD is crucial in identifying and managing this sleep disorder. Genetic, environmental, and lifestyle factors can trigger DPSD, and certain risk factors may increase an individual's susceptibility to the disorder. Identifying potential comorbidities. Chapter 4. Diagnosis and Assessment of DPSD. DPSD, or Delayed Phase Sleep Disorder, is a condition that requires careful diagnosis and assessment to accurately identify and understand its unique features. In this chapter, we will delve into the clinical evaluation and diagnostic criteria for DPSD, explore sleep studies and monitoring techniques used in DPSD diagnosis, discuss psychological assessment and screening for coexisting mental health conditions, and highlight the challenges and considerations in accurately diagnosing DPSD. Clinical evaluation and diagnostic criteria for DPSD. When it comes to diagnosing DPSD, a comprehensive clinical evaluation is essential. The diagnostic criteria for DPSD typically include a thorough medical history, including sleep patterns, sleep-wake schedule, and any underlying medical conditions that may impact sleep. Additionally, a detailed assessment of the patient's sleep habits, sleep hygiene, and lifestyle factors is crucial in identifying any potential triggers or contributing factors to the delayed sleep-wake pattern. Furthermore, a clinical evaluation may involve assessing the patient's circadian rhythm function, as disruptions in the circadian rhythm are often associated with DPSD. This may involve evaluating the patient's exposure to light and darkness, as well as their response to light cues and timing of melatonin production. Sleep studies and monitoring techniques used in DPSD diagnosis. Sleep studies, also known as polysomnography, PSG, can play a significant role in the diagnosis of DPSD. PSG is a non-invasive technique that involves monitoring various physiological parameters during sleep, such as brain activity, eye movement, muscle tone, heart rate, and respiratory function. In DPSD diagnosis, a specialized PSG may be conducted to assess the timing and quality of the patient's sleep. This may involve monitoring the patient's sleep-wake schedule over several nights to identify any consistent delayed sleep onset times or disruptions in the sleep pattern. Additionally, actigraphy, which involves wearing a wristwatch-like device that measures light exposure and activity levels, may be used to provide additional data on the patient's sleep-wake patterns and circadian rhythm function. Psychological assessment and screening for coexisting mental health conditions. As DPSD can often be associated with mental health conditions, a comprehensive psychological assessment is crucial in the diagnostic process. This may involve conducting structured interviews, questionnaires, and assessments to evaluate the patient's mental health, including their mood, anxiety levels, and cognitive function. Screening for coexisting mental health conditions such as depression, anxiety disorders, and attention deficit/hyperactivity disorder, ADHD, may also be conducted to identify any potential underlying causes or contributing factors to DPSD. Challenges and considerations in accurately diagnosing DPSD. Diagnosing DPSD can be challenging due to several factors. One of the primary challenges is that DPSD often goes unnoticed or misdiagnosed, as delayed sleep onset times may be attributed to poor sleep habits or lifestyle choices. Additionally, DPSD may coexist with other sleep disorders or mental health conditions, further complicating the diagnostic process. Another consideration is that DPSD is often a diagnosis of exclusion, meaning that other potential causes of delayed sleep-wake pattern need to be ruled out first. This may involve conducting comprehensive evaluations and assessments to eliminate other sleep disorders, medical conditions, or lifestyle factors that may impact sleep. Furthermore, cultural and societal norms, such as work or school schedules, may not align with an individual's delayed sleep-wake pattern, leading to challenges in accurately identifying DPSD. It is crucial for healthcare providers to consider the patient's unique circumstances and thoroughly assess all relevant factors in the diagnostic process. In conclusion, diagnosing and assessing DPSD requires a comprehensive approach that includes clinical evaluation, sleep studies, psychological assessment, and consideration of challenges and unique considerations. Accurate diagnosis is crucial in developing appropriate treatment plans and interventions to help. Chapter 5. Living with DPSD, Challenges and Coping Strategies. As the sun sets and the day turns into night, many people look forward to winding down, getting some restful sleep, and waking up refreshed in the morning. However, for those who live with delayed sleep phase disorder, DPSD, this daily routine can be disrupted in significant ways. In this chapter, we will explore the challenges faced by individuals with DPSD and the coping strategies they employ to manage their condition. Impact of DPSD on daily routine, relationships, and mental health. DPSD can have a profound impact on various aspects of an individual's life. One of the most noticeable areas is the disruption of their daily routine. People with DPSD often find it challenging to align their sleep schedule with societal norms, as their natural sleep-wake cycle is delayed. This misalignment can lead to difficulties in meeting work, school, or social commitments that follow a conventional schedule. It may also result in feeling out of sync with family and friends, leading to strained relationships and feelings of isolation. Furthermore, DPSD can take a toll on an individual's mental health. The constant struggle to adjust to a typical sleep schedule can result in chronic sleep deprivation, which can contribute to mood disorders such as depression and anxiety. The frustration of not being able to fall asleep at a normal time or waking up feeling groggy despite getting enough sleep can also lead to feelings of frustration, stress, and low self-esteem. Sleep hygiene practices and lifestyle changes for managing DPSD. Despite the challenges posed by DPSD, there are various sleep hygiene practices and lifestyle changes that can help individuals manage their condition. Establishing a consistent sleep routine by going to bed and waking up at the same time every day, even on weekends, can help regulate the body's internal clock. Creating a relaxing bedtime routine, such as avoiding stimulating activities before bedtime and creating a calm sleep environment, can also aid in falling asleep. Managing exposure to light is another crucial factor in managing DPSD. Light exposure, particularly to natural sunlight during the day, can help regulate the body's circadian rhythm and promote a healthy sleep-wake cycle. Conversely, limiting exposure to bright screens, such as those from electronic devices, close to bedtime can help reduce the disruptive effects of blue light on sleep. Coping strategies for dealing with the challenges of DPSD. Dealing with the challenges of DPSD can be emotionally and mentally taxing. However, there are coping strategies that individuals can employ to help manage their condition. Seeking support from healthcare professionals, such as sleep specialists, therapists, or counselors, can provide valuable guidance and strategies tailored to an individual's specific needs. Cognitive behavioral therapy for insomnia, CBTI, has been shown to be particularly effective in managing sleep disorders like DPSD. Self-care practices, such as engaging in regular physical exercise, practicing stress-reducing techniques like mindfulness and relaxation exercises, and maintaining a healthy diet, can also contribute to better sleep and overall well-being. Additionally, finding ways to manage stress and cope with the emotional impact of DPSD, such as talking to supportive friends and family members, journaling, or engaging in hobbies and activities that bring joy, can be beneficial. Real-life experiences and tips from individuals with DPSD. Hearing from individuals who have lived with DPSD and successfully managed their condition can provide valuable insights and inspiration. In this chapter, we will share real-life experiences and tips from individuals who have learned to navigate the challenges of DPSD. They will share their stories of resilience, strategies they have found effective in managing their condition, and the lessons they have learned along the way. Their experiences and tips will serve as a source of encouragement and guidance for others facing similar challenges. Conclusion. Chapter 6. Treatment Approaches for Delayed Sleep Phase Disorder, DPSD. Sleep disorders can significantly impact one's quality of life and overall well-being. Among the various types of sleep disorders, delayed sleep phase disorder, DPSD, poses unique challenges due to its characteristic pattern of delayed sleep-wake timing. However, there are several treatment approaches available for managing DPSD, ranging from conventional medications to alternative and complementary therapies. In this chapter, we will explore the current treatment options for DPSD, including medications, light therapy, and chronotherapy, as well as cognitive behavioral therapy for insomnia, CBTI, as a management strategy. Additionally, we will delve into the latest research and emerging treatment modalities for DPSD. Medications have been widely used in the management of DPSD. Chronobiotics, such as melatonin and its analogs, are commonly prescribed to help regulate sleep-wake timing. Melatonin is a hormone that is naturally produced by the pineal gland in the brain and plays a role in regulating the sleep-wake cycle. It is available in synthetic form as a dietary supplement and has been shown to be effective in advancing or delaying sleep-wake timing, depending on the timing of administration. Other medications, such as sedatives and hypnotics, may also be used to promote sleep, but their long-term use is generally not recommended due to the risk of dependence and potential side effects. Light therapy is another approach used in the treatment of DPSD. This therapy involves exposure to bright light, typically in the morning or evening, to help regulate the body's internal clock and adjust the sleep-wake cycle. Light boxes or lamps that emit bright light with specific wavelengths and intensity are commonly used in light therapy for DPSD. The timing, duration, and intensity of light exposure are carefully regulated based on individual needs and response. Chronotherapy is a specialized treatment approach that involves gradually shifting the bedtime and wake time over a period of several days or weeks. This approach aims to realign the sleep-wake cycle with the desired schedule, such as advancing bedtime and wake time for individuals with delayed sleep-wake timing. Chronotherapy requires careful planning and monitoring, and it is usually recommended under the supervision of a healthcare professional. Cognitive behavioral therapy for insomnia, CBTI, is a well-established and effective treatment approach for managing insomnia, which can be useful in the management of DPSD as well. CBTI involves various techniques and strategies to identify and address the underlying causes of sleep problems. It may include components such as sleep hygiene education, stimulus control therapy, relaxation techniques, and cognitive restructuring to help individuals develop healthier sleep habits and improve sleep quality. In addition to conventional treatments, alternative and complementary therapies have gained popularity as adjunctive approaches for managing DPSD. These may include relaxation techniques such as yoga, meditation, and mindfulness, as well as herbal supplements or dietary changes that are believed to promote better sleep. It is important to note that while some individuals may find these therapies helpful, scientific evidence supporting their efficacy in managing DPSD is limited, and they should be used with caution and under the guidance of a healthcare professional. Furthermore, ongoing research continues to explore emerging treatment modalities for DPSD. This includes investigations into the use of transcranial magnetic stimulation, TMS, which uses magnetic fields to stimulate specific areas of the brain to modulate sleep-wake patterns. Other promising approaches being studied include the use of non-pharmacological interventions, such as sleep restriction therapy and bright light exposure during specific time windows, as well as the development of novel medications targeting specific sleep-related pathways in the brain. In conclusion, the management of DPSD involves a multifaceted approach that may include various treatment options. Medications, light therapy. Chapter 7. Lifestyle adjustments and sleep hacks for DPSD. As the understanding of delayed sleep phase disorder, DPSD, continues to evolve, so do the treatment options available for managing this condition. In addition to medical interventions, lifestyle adjustments and sleep hacks can play a crucial role in improving sleep quality and aligning the sleep-wake schedule with the desired timing. This chapter explores various strategies that individuals with DPSD can incorporate into their daily routines to optimize their sleep patterns and enhance their overall well-being. Current treatment options for DPSD: medications, light therapy, and chronotherapy. Medications, light therapy, and chronotherapy are among the conventional treatment options that have been utilized in managing DPSD. Medications such as melatonin and sedatives can be prescribed to help regulate the sleep-wake cycle and improve sleep initiation and maintenance. Light therapy, involving exposure to bright light during the morning or evening, can help reset the circadian rhythm and promote earlier sleep onset. Chronotherapy, on the other hand, involves gradually shifting the bedtime and wake time to align with the desired schedule. These treatments can be effective for some individuals with DPSD, but they may not work for everyone or may come with potential side effects. Therefore, incorporating lifestyle adjustments and sleep hacks can complement these interventions and improve treatment outcomes. Cognitive behavioral therapy for insomnia, CBTI, in DPSD management. Cognitive behavioral therapy for insomnia, CBTI, is a well-established and effective approach for managing various types of sleep disorders, including DPSD. CBTI focuses on identifying and addressing the cognitive and behavioral factors that contribute to sleep difficulties. This may include identifying and challenging negative thoughts about sleep, developing healthy sleep habits, and establishing a consistent sleep schedule. CBTI can also address any underlying psychological factors, such as stress or anxiety, that may be impacting sleep quality. Implementing CBTI techniques can help individuals with DPSD develop healthy sleep patterns and improve their overall sleep quality. Alternative and complementary therapies for DPSD. In addition to conventional treatments, alternative and complementary therapies can be explored as adjunctive strategies for managing DPSD. These therapies may include relaxation techniques such as mindfulness meditation, progressive muscle relaxation, and breathing exercises. These practices can help individuals with DPSD relax and calm their minds, making it easier to fall asleep at the desired time. Acupuncture, aromatherapy, and herbal supplements are other alternative therapies that some individuals may find beneficial in managing their sleep-wake cycle. However, it's important to consult with a healthcare professional before trying any alternative or complementary therapies to ensure safety and effectiveness. Latest research and emerging treatment modalities for DPSD. As the field of sleep medicine continues to evolve, new research and emerging treatment modalities are constantly being explored for managing DPSD. Some of the latest research includes investigating the role of genetics in DPSD, as certain genes have been found to be associated with circadian rhythm disturbances. Additionally, emerging treatment modalities such as transcranial magnetic stimulation, TMS, and virtual reality-based interventions are being explored for their potential in managing DPSD. These novel treatments may offer promising options for individuals who do not respond to conventional treatments or who are looking for alternative approaches to manage their sleep disorder. In conclusion, while conventional treatments such as medications, light therapy, and chronotherapy continue to be widely used in managing DPSD, lifestyle adjustments and sleep hacks can play a complementary role in optimizing sleep quality and aligning the sleep-wake schedule with the desired timing. Cognitive behavioral therapy for insomnia, CBTI, can also be effective in managing DPSD by addressing cognitive and behavioral factors that contribute to sleep difficulties. Alternative and complementary therapies may offer additional options for some individuals. Chapter 8. Thriving with DPSD, Achieving Quality of Life. Sleep disorders, such as delayed phase sleep disorder, DPSD, can significantly impact an individual's mental and emotional well-being. However, with the right strategies, it is possible to thrive and achieve a fulfilling life even with DPSD. In this chapter, we will explore various techniques for maintaining mental and emotional well-being, nurturing relationships, achieving work-life balance, and finding inspiration from real-life success stories of individuals who have managed DPSD. Strategies for maintaining mental and emotional well-being with DPSD. Living with DPSD can often lead to feelings of frustration, anxiety, and even depression due to the misalignment between the internal biological clock and the external world. It is crucial to develop coping strategies to manage these challenges. One effective approach is to establish a consistent sleep routine, including a regular sleep schedule, winding down routine, and creating a sleep-friendly environment. Additionally, practicing relaxation techniques, such as deep breathing, meditation, or yoga, can help calm the mind and promote better sleep. It's also important to pay attention to one's mental health. Seeking support from a therapist or counselor can provide valuable tools to manage the emotional impact of DPSD. Developing healthy coping mechanisms, such as journaling, engaging in hobbies or activities that bring joy, and practicing self-compassion, can also help individuals navigate the emotional ups and downs of living with DPSD. Nurturing relationships, communicating with family, friends, and employers. Maintaining healthy relationships with family, friends, and employers is crucial for individuals with DPSD. Communication plays a vital role in setting expectations and understanding among loved ones and colleagues. It is essential to educate them about DPSD and its impact on your sleep patterns, and to discuss potential adjustments that may be needed, such as flexible work hours or social activities that align with your sleep schedule. Being open and honest about your condition can help reduce misunderstandings and foster supportive relationships. It's also important to establish boundaries and prioritize self-care to avoid overexertion or burnout. Surrounding oneself with understanding and empathetic individuals can greatly contribute to mental and emotional well-being. Achieving work-life balance with DPSD, career strategies, and time management. Balancing a career with DPSD can be challenging, but with careful planning and organization, it is possible to achieve work-life balance. Identifying one's optimal work hours and scheduling tasks accordingly can help manage productivity and reduce sleep disruption. Utilizing technology, such as remote work options or flexible scheduling, can also provide greater flexibility in managing work commitments. Time management is crucial for individuals with DPSD. Prioritizing sleep and self-care, as well as scheduling regular physical exercise, can help manage symptoms and promote better overall well-being. Creating a daily routine that accommodates both work and personal needs can foster a sense of control and balance. Inspiring stories of individuals who have successfully managed DPSD and achieved a fulfilling life. Real-life success stories can provide inspiration and motivation for individuals living with DPSD. Hearing about others who have successfully managed their condition and achieved a fulfilling life can instill hope and confidence. These stories can also provide practical tips and strategies that others can apply in their own lives. In this chapter, we will showcase stories of individuals who have successfully managed DPSD and found ways to thrive in various areas of life, such as career, relationships, and personal growth. These stories will highlight different approaches and strategies that have been effective in managing DPSD and the positive outcomes that can be achieved with determination, resilience, and support. Chapter 9: Support Systems and Resources for DPSD. Having access to support systems and resources is crucial for individuals living with DPSD. In this chapter, we will explore support systems and resources for DPSD. As Maria continued her journey to manage her delayed phase sleep disorder, DPSD, she realized the importance of building a strong support system around her. She knew that connecting with others who understood her condition would provide her with the necessary support and resources to navigate the challenges of living with DPSD. Connecting with support groups, communities, and advocacy organizations. Maria took the initiative to seek out support groups, communities, and advocacy organizations that focused on DPSD. She found online forums where people with DPSD shared their stories, experiences, and coping strategies. She also joined social media groups where individuals with similar sleep disorders connected and supported each other. Through these online communities, Maria was able to find a sense of belonging and realized that she was not alone in her struggles. She gained valuable insights, tips, and advice from others who had successfully managed their DPSD. She was able to share her own challenges and learn from the collective wisdom of the group. Seeking professional help, sleep specialists, therapists, and healthcare providers. In addition to connecting with support groups, Maria also sought professional help to manage her DPSD. She researched and found sleep specialists who were experienced in dealing with circadian rhythm disorders, including DPSD. She made an appointment with a sleep specialist who conducted a thorough evaluation and provided her with personalized treatment options. Maria also sought therapy to address the emotional impact of DPSD on her mental health. She found a therapist who specialized in sleep disorders and cognitive behavioral therapy for insomnia. Through therapy, Maria learned effective coping strategies, relaxation techniques, and stress management skills that helped her better manage her DPSD. Maria also maintained regular visits with her healthcare provider to monitor her overall health and address any medical issues related to her DPSD. Her healthcare provider helped her understand the potential risks and complications associated with DPSD and provided her with appropriate medical interventions when needed. Navigating medical and legal issues related to DPSD. Maria realized that DPSD could sometimes pose medical and legal challenges, and she took proactive steps to address them. She educated herself about the legal rights and accommodations available to individuals with sleep disorders, including DPSD. She sought legal advice when needed, especially in her workplace, to ensure that her rights were protected and reasonable accommodations were provided to manage her DPSD effectively. Maria also stayed informed about the latest research and developments in DPSD management. She kept herself updated with scientific journals, online resources, and reputable websites that provided reliable information on DPSD, including its causes, symptoms, and treatment options. Helpful resources for further information and support on DPSD. Maria found several helpful resources that provided further information and support on DPSD. She discovered websites of reputable organizations that focused on sleep disorders, such as the National Sleep Foundation and the American Academy of Sleep Medicine. These websites provided comprehensive information on DPSD, including its diagnosis, treatment options, and lifestyle changes. Maria also found online resources that offered tools and techniques for managing DPSD, such as sleep tracking apps, relaxation techniques, and sleep hygiene tips. She also found books, articles, and podcasts written by sleep experts and individuals who had successfully managed their DPSD, which provided her with additional insights and inspiration. In conclusion, Maria realized that building a strong support system and accessing relevant resources were essential for managing her DPSD effectively. Connecting with support groups, communities, and advocacy organizations, seeking professional help from sleep specialists, therapists, and healthcare providers, navigating medical and legal issues, and accessing helpful resources for information and support were crucial steps in her journey to manage DPSD. With these resources in place, Maria felt empowered and better equipped to face the challenges of living with DPSD and improving her quality of life. Chapter 10. The Future of DPSD: Research, Innovations, and Hope. The field of delayed phase sleep disorder, DPSD, research has seen significant advancements in recent years, providing hope for those who struggle with this challenging condition. In this chapter, we will explore the latest developments in DPSD research and potential future developments, as well as promising treatment options on the horizon. We will also discuss the importance of empowering the DPSD community through raising awareness and advocacy efforts, and look towards a hopeful future with improved understanding, management, and outcomes for DPSD. Latest advances in DPSD research and potential future developments. In recent years, research into DPSD has gained momentum, leading to new insights and potential breakthroughs. Scientists have been investigating the underlying causes of DPSD, including genetic, neurological, and environmental factors. Studies have identified various genes and proteins that may play a role in regulating the circadian rhythm and sleep-wake cycle, shedding light on the molecular mechanisms that contribute to DPSD. Advancements in imaging techniques, such as functional magnetic resonance imaging, fMRI, and electroencephalography, EEG, have allowed researchers to better understand the brain activity patterns associated with DPSD. This has led to a deeper understanding of the neural networks involved in the regulation of sleep-wake cycles and circadian rhythms, providing new targets for potential therapeutic interventions. Furthermore, advancements in wearable devices and mobile applications have enabled individuals with DPSD to monitor and track their sleep patterns, providing valuable data for researchers to analyze. These technological innovations have also allowed for the development of personalized treatment plans and interventions, tailored to the specific needs of individuals with DPSD. Promising treatment options on the horizon for DPSD. Although DPSD can be a challenging condition to manage, there are promising treatment options on the horizon. Traditional treatments such as bright light therapy, melatonin supplements, and sleep hygiene practices have shown some success in managing DPSD symptoms. However, emerging research has also revealed novel therapeutic approaches that hold promise for the future. One such promising treatment is chronotherapy, which involves gradually adjusting the sleep-wake schedule to align with the desired sleep timing. Chronotherapy has shown promising results in some individuals with DPSD, helping to gradually shift their sleep-wake cycles and improve their overall sleep quality. Additionally, ongoing research is exploring the potential of targeted drug therapies that specifically target the underlying molecular mechanisms involved in DPSD. These medications may help regulate the circadian rhythm and sleep-wake cycle, providing more effective and targeted treatment options for DPSD. Empowering the DPSD community, raising awareness and advocacy efforts. Raising awareness and advocacy efforts play a crucial role in empowering the DPSD community. As DPSD is still not widely understood or recognized by the general public, advocacy efforts are needed to increase awareness, promote understanding, and reduce stigma associated with this condition. Advocacy groups and organizations dedicated to sleep disorders, including DPSD, are actively working towards promoting education, research, and support for individuals affected by DPSD. These efforts aim to raise awareness among healthcare professionals, policymakers, and the public, and to advocate for better access to diagnosis, treatment, and support for individuals with DPSD. Furthermore, individuals with DPSD and their families are encouraged to become advocates themselves by sharing their stories, participating in research, and raising awareness in their communities. By coming together as a community and advocating for their needs, individuals with DPSD can help drive positive change and improve the lives of those affected by this condition. Hope for the future, promoting better understanding, management, and outcomes for DPSD. Promising signs that indicate a brighter tomorrow for individuals affected by DPSD. These developments are paving the way for improved diagnosis, management, and support for those living with DPSD, and are driving positive change in the field. Additionally, the growing recognition of the impact of DPSD on individuals and their communities has spurred advocacy efforts to raise awareness, reduce stigma, and promote access to resources and support. With continued research, innovation, and advocacy, there is a real possibility of overcoming the challenges of DPSD and creating a better future for those affected by it.